In general, I prefer to place the patient in dorsal recumbency and look for the gallbladder in a ventral midline sagittal view from a subxiphoid transducer position. However, in some patients, the gallbladder cannot be seen from this position. In addition, some patients may have injuries, respiratory distress, or some other clinical complication that may require a different patient position or transducer position to find and evaluate the gallbladder. You need to be flexible and move the transducer to whatever position is needed to see the gallbladder. Let's begin with a cat gallbladder. Place the transducer in a perpendicular position near the ventral midline and to the patient's right side of the xiphoid. Angle the transducer cranially to find the liver. Adjust depth so that the liver fills the ultrasound screen from the top of the screen to the bottom of the screen. The diaphragm should be to the left side of the ultrasound screen. Fan the transducer to the patient's right side to find the gallbladder. If necessary, rotate the transducer clockwise or counterclockwise to find the long axis of the gallbladder. If necessary, slide the transducer along the rib to the patient's right side. Decrease depth to magnify the gallbladder for study. Decrease gain in the area of the gallbladder to reduce artifact. If needed, apply pressure to the transducer to get it closer to the gallbladder for a better image. Press the freeze button and release pressure on the transducer. Use Cinematic Loop to scroll backward or forward to find the best image. Place an arrow on the gallbladder, label the image gallbladder, and save the image to the patient record or archives. Unfreeze the ultrasound machine. Fan the transducer slowly to the patient's right side till the gallbladder disappears. Then reverse directions and fan to the patient's left till the gallbladder disappears, to be sure you have seen all of the gallbladder and its contents. If I see or suspect a lesion of the gallbladder, I rotate the transducer to a transverse position, fan cranially, and then caudally to see all of the gallbladder and confirm a lesion in a second view. Then I rotate back to a sagittal or long axis position. In some cases, the gallbladder may be difficult to see from the subxiphoid position in a patient in dorsal recumbency because the patient has a stomach full of food or gas. In some narrow-chested breeds like Whippets, Collies, some Shepherds and Dobermans, there is no room to maneuver the transducer at the subxiphoid position. In such a case, the transducer can be placed over the patient's rib spaces on the right or left side and in a sagittal or transverse position. You can place the transducer wherever it needs to be to see the gallbladder. Rib shadows may partially obstruct the view in an intercostal approach. On the ultrasound screen, we begin in a ventral midline sagittal position, then move the transducer to a right lateral view between the ribs. The transducer is often close to the sternum for the best view between the ribs. The transducer can be sagittal or transverse. The transducer could also be placed over the left ribs wherever it needs to be to see the gallbladder. Intercostal views may be necessary if the liver is very small or cirrhotic. With cirrhosis of the liver and gallbladder may only be seen from either the left or the right side between the ribs. For obtaining a bile sample from the gallbladder, it may be best to approach from the patient's right side between the ribs. The patient can be placed in left lateral recumbency and will need to be under anesthesia. Again, the gallbladder can be viewed from a sagittal or transverse position, but for the bile aspirate, the transducer should be placed so that the ultrasound beam is between the ribs. The needle will also be placed between the patient's ribs. The right 10th intercostal view is used mainly in large or deep-chested dogs to view right cranial abdominal structures such as the portal hilus, aorta, caudal vena cava, gallbladder, and common bile duct. A right lateral intercostal approach from the last 3 or 4 intercostal spaces is used, and transducer pressure must be applied to collapse the lungs. The patient can be in dorsal or left lateral recumbency. In some situations, the patient's gallbladder is viewed first in a dorsal or lateral recumbency position, and then the gallbladder is viewed again with the patient in a standing or sitting position. Gravity-dependent contents such as stones, sludge, inspisation, and mucoid plugs will change positions within the gallbladder. Non-gravity dependent items such as polyps, tumors, and mucoceles will not change positions. Occasionally, an animal is born without a gallbladder. It simply did not develop. This video is from a 10-year-old spayed female beagle with daily vomiting of yellow bile for 2 months. There were mild elevations of ALT, GGT, and total bilirubin. Ultrasound is from the patient's right lateral side between the ribs. On the ultrasound, no gallbladder is seen. There is no dilation of the common bile duct or intrahepatic bile ducts to support extrahepatic biliary obstruction. Intrahepatic obstruction due to primary liver disease was suspected. The gallbladder could not be found from any position on ultrasound. Sometimes a small remnant is found where the gallbladder is expected to be near the common bile duct. Be sure to determine that the gallbladder was not previously surgically removed.